I'll just go ahead and say it right away. If you have chronic or any type of non-specific back pain, you probably shouldn't do surgery. And I think the same is true for a lot of degenerative disc disease or herniated discs. Before we get into it, I'm not your doctor, I'm not a doctor, I don't even play one on TV. I'm just someone who went through a lot of back pain, and I believe a lot of it was needless. More importantly, I was told by a lot of doctors that the chances of me actually healing completely are very low, that I shouldn't really get my hopes up too much. Treatment and management were my best and only options, and I should kind of like accept a life of permanent pain. And yet, eventually, I somehow got better. I almost have no back pain anymore. It's very rare that I have like nasty episodes. And I even feel better than I felt in my younger days, which is, technically it's not something that's supposed to happen. I do have a ton of experience with back pain. The solutions that ended up working the most are actually not something that doctors usually recommend. Some of them did mention surgery, however. I'm really glad I didn't take their advice on that one, because I think it would have been a huge mistake. Now, let's be perfectly clear here. There are some situations where surgery is a viable option at the very least. You should consider it in cases where maybe you have a very specific, well-defined disease or problem. Things like fractures, spinal tumors, infections, like even slipped vertebrae, or maybe like more severe deformities. These are problems that may be best addressed with surgery. And when it comes to these issues, I'm not exactly very familiar with them. I haven't gone through with any of them, so I'm not the first person you should talk to about this. But I would still probably recommend getting at least several opinions if you hear the word surgery. Maybe get a second or even a third opinion, because usually surgery should be the very last ditch effort. Now, luckily for a lot of us, those types of problems are not what's actually bothering us. Chances are a lot of us suffer from something more like a vague, like a slippery type of back pain problem. It's usually difficult to isolate, to diagnose. It may come and go, the intensity may vary. It's generally difficult to put a finger on it and diagnose it properly. For those types of problems, there are plenty of solutions that are much better. Unfortunately, those solutions are often not the ones recommended by doctors. Doctors typically recommend something entirely different. They usually go with a lot of painkillers, maybe injections, maybe even surgery in some cases. They often like to recommend topical remedies, which, and even like lately I've noticed there's some sort of a trend towards chiropractic and massage and a lot of physiotherapy as well. I'm not saying all of those are ineffective. They didn't do a lot for me, but this is what doctors recommend. I don't think that's actually the right answer in a lot of cases. It may be helpful to you, so maybe don't just ignore doctors right away. Maybe give them a shot, like maybe some of these things can work. But I have a strong suspicion the right answer will be different in a lot of cases. By the way, I have an entire video on what works that doctors never recommend, so if you want to watch me fire shots at doctors, go check it out. It should appear like somewhere around here. And honestly, like I try to be understanding of doctors. They do have like a really difficult job. It's an important job. Probably the last thing they need is some like know-it-all YouTuber making their lives even more difficult. But they do happen to have quite a few flaws, if I'm being honest. Doctors are often like, how should we say this? Let's say their advice is not very effective. I mean, I'm sure there's plenty of good doctors out there, but in my case, the doctors even kind of did a lot of harm and not a lot of good, actually. So I'm a little bit biased in this regard. I hope you have like access to excellent doctors. If you don't, if you're like me and maybe you're not so lucky, you're gonna have to kind of figure things out on your own. Luckily, it's not so difficult, and this channel offers a lot of resources. They're free, so I think your odds are actually looking pretty good. Now, personally, I talked to like a dozen doctors at least. None of them recommended anything good, which is why I'm quite skeptical. But I don't think it's their fault entirely. I think they're actually using like an outdated playbook of some sorts. They try to address this problem as it's like a purely mechanical issue, which I don't think is it's always the case. Oftentimes, the solution involves some sort of a lifestyle modification, and doctors are typically not really good at this type of like healing of these types of recommendations. Surgery is really not that effective, especially for these types of problems. When it comes to chronic back pain, degenerative disc disease, even like herniated or ruptured discs, surgery has actually a pretty low success rate. Lots of people see absolutely no improvement, no results at all. For some of them, the pain is even worse after the surgery. And tons of other people do one surgery, they maybe see like some sort of a tiny improvement, but that quickly goes away and they have to do another surgery after that. And we're not even touching on the risks of the surgery itself. I mean, it's a really difficult surgery. The surgeons that are going to operate like on the spine or close to the spine, they may hit like some nerve. There's a lot of like critical sensitive tissue involved. It's not something that should be taken lightly. And the worst part is that oftentimes the diagnosis for back pain is not even like close to the root cause of the back pain. A herniated disc is actually a really good example of this. So everybody knows, everybody agrees that herniated discs are what causes back pain. But as it turns out, a lot of people have herniated discs and they don't have back pain. Weird, right? I mean, I guess your discs shouldn't be herniated or bulging, but at the same time, I think that sounds worse than it actually is, especially if we consider the fact that a lot of back pain has nothing to do with discs at all. The main root cause, by the way, is often unresolved psychological and emotional issues. I know this is hard to believe, but that's pretty much how I resolved my own back pain, and I think that's gonna be helpful for a lot of people. That's one approach that's really safe. It's not invasive at all. It doesn't involve even like dangerous medicine or painkillers or anything of that sort. It does require a lot of work, but it's nowhere near as dangerous or risky as surgery. And honestly, sometimes I get like chills down my spine when I think about this. So I was kind of recommended to go with some sort of like very dangerous, risky surgery, when in fact the answer was just fix your nutrition, get more exercise, and do like a little bit of journaling and figuring things out. Yeah, it's tricky. In general, if you don't have a very specific, well-defined problem, you should probably avoid surgery. And this is especially true if you work some type of an office job. It seems to be very common among programmers. I'm a programmer myself. I know a lot of other programmers. All of us have like messed up backs. And it's not just programmers, it's any type of like computer nerds or office workers or anyone who sits in a chair for more than 4 or 6 hours a day and who probably believes that the outdoors isn't real and everything happens only on the computer screen on the internet. Basically, if your butt is in a chair for more than 4 hours a day, you might have a messed up back, and the solution is not surgery in a lot of these cases. If you want to know the right answers, I actually wrote a completely free book. This is like a total real book, not like some ChatGPT garbage. 150 or maybe even more pages of real world experiences. I went through what works, what doesn't work. Anyway, go check it out, completely free. The link should be in the pinned comment or description. You will see what works, what doesn't work, and how to craft a strategy that's designed specifically for you in your life, in your context. My name is Mate with Real Deal Heal. It probably might be a good idea for you to like and subscribe if you're suffering from any type of back pain. I offer a lot of free resources here and also like outside of this channel as well. I've been through all of this. I know how much it sucks. I know how much it sucks to go through it alone. I want to give you as much support as I can. You don't have to do this on your own. Also share this with anyone who also struggles with back pain. Let me know if you have any questions in the comments. I'll try to answer them all. And for whatever reason, if you want to keep binging on these videos and watch me like talk about back pain, I think this next video that's gonna appear here should be a great choice. I'll see you there, and until next time, be brave.